Hospitals. Unit 9. Good morning. We are Good 9 made up of Elizabeth de la Rosa, Diana Rojas, Laura Joaquim, and Yasmirady Diaz, who is speaking to you. Today we are going to be talking about introduction to a hospital. Jordi Pons is a first-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary Edinburgh. Dr. Baron is introducing him in the hospital. Dr. Baron, Dr. Baron. The Royal Infirmary is the name of the University Hospital for the Edinburgh University. It is a general hospital dealing with all types of patients and illnesses except pediatrics. We had a specialist hospital for the East and other part of Edinburgh, the hospital for sick children. You can see some of the departments in our hospital on design. Bien. Jordi Pons es un estudiante de cuarto año de medicina de Barcelona. Ha venido a Gran Bretaña como agregado electivo a la Enfermería Real de Edimburgo. El Dr. Barron lo está introduciendo en el hospital. Dr. Barron. The Royal Infirmary es el nombre del hospital general que atiende a todo tipo de pacientes y enfermedades, excepto pediatría. Tenemos un hospital especializado para eso en otra parte de Edimburgo. El hospital para niños enfermos puede ver algunos de los departamentos de nuestro hospital en el letrero.
My name is Elizabeth de la Rosa. Of course, there are many others. For example, the Intensive Care Unit, ICU, and the Surgical High Dependency Unit, HDU. Jordi, what does outpatient mean? Dr. Bayron, outpatient are the people who come to hospital to attend a clinic or to have tests or treatment and then return home on the same day. Inpatient stay in the hospital for 1 or more days. The rooms where they stay are called wards. If a patient treatment requires only 1 day, such as a simple operation, they can be admitted to the day surgery unit. I go to translate the conversation to Spanish. Por supuesto, hay muchos otros. Por ejemplo, la unidad de cuidados intensivos, UCI, y la unidad de alta dependencia quirúrgica, UDU. Jordi, ¿qué significa ambulatorio? Dr. Bayron, los pacientes ambulatorios son las personas que vienen al hospital para asistir a una clínica o para someterse a pruebas o tratamiento y luego regresan a casa el mismo día. Los pacientes hospitalizados permanecen en el hospital durante 1 o más días. Las habitaciones donde se hospedan se llaman salas. Si el tratamiento de un paciente requiere solo un día, como una operación simple, puede ser ingresado en la unidad de cirugía de día.
Hi, good morning. In today's class, I'm going to talk about outpatients. Dr. Baron. The Accident and Emergency Department, ASCA, also called casualty, is where patients who are acutely ill with a sudden serious condition come for an assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatients department, OPDS. They have usually been referred to the hospital by the GP, who writes a referral letter to the consultant explaining the patient's problem. El departamento de accidentes y emergencia es donde los pacientes que están gravemente heridos con una condición repentina y grave acuden para evaluación y tratamiento. Los pacientes ambulatorios que tienen una cita para ver a un especialista van a una clínica en uno de los departamentos de pacientes externos. Por lo general han sido remitidos al hospital por su médico de cabecera, quien escribe una carta de referencia al consultor explicando el problema del paciente.
Okay, this is Laura Joaquin. I'm gonna read part C, which is called impatience. The impatience, well, Dr. Barron says, the impatients in a hospital are admitted in one of three main ways. They may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, their GP, general practitioner, may arrange the admission by telephone because they are acutely ill, for example with suspected myocardial infarction, or they are seen in the A&CE department where the doctor on duty or working at that time arranges the admission. This would happen in the case of a patient with a fractured neck of femur, for example. Larger hospitals may have an assessment unit where patients can be admitted temporarily while their condition is assessed. Jordi says, assessed? Dr. Barron says, yes, decisions are made about their condition and what needs to be done to help them. After treatment is completed, the patient is discharged back to the GPS care. Now I'm gonna read it in Spanish. Esta es la parte C. Pacientes internos. Dice el doctor Barron, los pacientes internos en un hospital son admitidos en una de tres principales maneras. Ellos deben ser vistos en alguno de las clínicas para pacientes de paso y admitidos por esa vía, o si hay mucha demanda para el tratamiento que ellos necesitan, como en el caso de un reemplazo de cadera, ellos pueden ser puestos en una lista de espera para ser admitidos. Alternativamente, su médico general puede arreglar la admisión por teléfono porque ellos están extremadamente enfermos. Por ejemplo, a alguien que se le sospecha que tiene un infarto al miocardio. Ellos deben ser vistos en el AIC departamento, donde el doctor de guardia, trabajando en ese momento, arregla la admisión. Esto pasaría en el caso de un paciente con el cuello del fémur fracturado, por ejemplo. Algunos hospitales más grandes pueden tener una área de evaluación, una unidad de evaluación, donde los pacientes pueden ser admitidos temporalmente mientras su condición es evaluada. Dice Jordi, ¿evaluada? El doctor Barron dice sí. Las decisiones son hechas dependiendo, de su condición y lo que se necesite hacer para ayudarles. Después de que el tratamiento se completa, los pacientes son dados de alta para donde el cuidado del médico general. Now we are going to be doing the exercises. So the first exercise is going to be 9.1. Complete the table with words for A, B, and C opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Okay, so for the verb admit, the noun will be admission, assess, assessment, discharge, discharge, operate, operation, refer, referral, treat, and treatment.
Make word combination using a word from Xbox. Look and see opposite to help you. Accurately assessment on referral waiting. Unit, little, list, duty, ill. For example, acutely ill, assessment unit, on duty, referral letter, and waiting list.
Exercise 9.3. Which hospital departments would be the most appropriate for the following patients? Look at A, B, and C opposites to help you. 1. A woman in diabetic coma, acutely ill. A patient who has just had a radical prostatectomy. Assessment unit. 3. A patient who is to have a skin lesion removed. Waiting list. 4. A man with a foreign body in his eye. On duty. Number 5. A woman with a treated abortion. Referral letter.
Exercise 9-fold. Complete the extract from an information leaflet for patients. Look at A, B, and C opposite to help you. Well, information for outpatients. When you at the hospital, please tell the receptionist who will welcome you check your details and direct you to the waiting area. The length of our visit will depend on the treatment you are going to have. You may need to have some tests such as an X-ray, which could mean going to another appointment will be arranged for you. Arranged for you if you need to be admitted to hospital for more treatment, either as an inpatient or for day surgery. You will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GPS care. Um, Thanks.